Dr. Derek Gallant. I'm the clinic director here. So welcome to Beverly Family Chiropractic. Basically our sort of vision here is that we believe that every human being is designed to be extraordinary. So we are basically have started a seminar series to focus on teaching people certain things that are going to help them create an extraordinary life. So if we can teach those requirements, eat, move, think, and power, they can live a life by design is what we call it. That's what the seminar series is called. So with those principles, you can experience, better sleep, more energy, clearer thinking, and a stronger immune system. So tonight the topic is Move by Design, specifically relating to pregnancy and pediatrics, or pregnancy and postpartum care. And I'm going to hand it off to Catherine in a second. I just wanted to, since this is a chiropractic office, just ask how many people knew that pregnant women go to see a chiropractor? Anyone? Yeah, a few people, right? So it's actually pretty common, but 1 in 6 women seek chiropractic care while they're pregnant. So what are some reasons why someone would go see a chiropractor when they're pregnant, or after pregnancy? Any ideas?
Can I say during pregnancy?
During.
My son was breech, so going to see a chiropractor helped give space. He didn't turn until he had to be turned, but it did help balance everything so that he did, when he was turning, had the space to engage, and things went perfectly good.
Right, so optimal position for the baby so that they have more room to grow. Sometimes it's a better alignment of the pelvis to help with delivery. A lot of times it's decreased pain or symptoms of nausea, and even decreased stress on the mom's vital organs. A lot of different reasons why people seek chiropractic care. I use an approach which focuses on correcting core problems with the spine and nerve system that could be affecting the way that you feel, or things that are affecting your baby could be affecting you in ways that you don't even feel at the moment. One cool thing about, a lot of times people think about chiropractic care is neck pain and headaches, and that's or back pain, that's all they think about. But research shows that actually with chiropractic care, it'll impact the pelvic floor muscles, which I think you might talk about tonight, I'm not sure. We haven't talked about it, but I'm guessing. So they found that women who are pregnant who are under chiropractic care have a greater ability to relax their pelvic floor muscles, which is going to help them have better chances of a natural and complication-free childbirth. So not only do we look at chiropractic care as a great resource or great care for someone who's pregnant, but besides that also recovery as well, and then just maintaining their health through and beyond that. Better for babes and moms. So we're excited that you're all here tonight, and Catherine's going to take it from here.
So a lot of you are my CrossFit friends, which nice to see you again, all of my CrossFit friends. So very interesting, the relaxation of the pelvic floor part. That is a huge part about what we're going to be talking about, because my CrossFit friends, one of the things that we have in common often is that we are tight in that area. And a tight muscle isn't always a strong muscle. So just keep that in mind as we're talking. Tight muscle isn't always a strong muscle. So here I am. Here we are, first trimester, second trimester, third trimester, and then birth. Yay! And for a lot of women, it's like, yay, baby is born! And then everything becomes baby, baby, baby. But what we need to be aware of and very thoughtful of is that our role and our bodies still need as much care as we gave them when we were pregnant, which is a lot about what we're going to talk about and think about as well. Like, how do you go about caring for yourself after the baby is born when everything becomes baby, baby, baby? So, never too early or too late to optimize your postpartum recovery. So, how long are you postpartum for? And don't, you cheated. How long are you postpartum for? Go ahead, Courtney, say it out loud.
Forever.
Ever and ever and ever. So if you've ever birthed a baby or been pregnant, when that baby is born, you are postpartum from then until forever and ever. So you change biologically, your brain changes, your body changes, your structure changes, and the body you had before does not exist because you have had this whole new adventure. So never too early or too late to optimize your postpartum recovery. So it doesn't matter if your youngest is 10 years old. If you've got some stuff happening, it's never too late to address any of that stuff. So the core canister. We don't just think about the core like, oh, look at your core, and the rectus abdominis six-pack muscle that we all think of with a core. That is like such a small component of it. So you have your diaphragm at the top, you have your transverse abdominis, that is this side muscle. So if you think about like trying to get into a really tight pair of jeans, or bringing these hip bones together. So everybody just in your chair, kind of sit up nice and tall, and think about bringing the points of your hip bones together, or sucking in for that tight pair of jeans. Not sucking in like belly button to spine, but just like that gentle right here. That's your transverse abdominis. It's the muscles we're trying to turn on. Those are your corseting muscles. So that's part of your core canister, and then you have the muscles of the pelvic floor. So all those things have to work together. Oops, sorry. And in the back of your multifidus muscles. So those are the muscles that are linking along with your spine. So those front, back, top, and bottom make up essentially like the Coke can of your core. So your core breath, how do all of these things work together? And we think about breathing like, oh, it's my lungs, or oh, it's my diaphragm, but we forget how all of these things work together. And for a lot of us, like pelvic floor, like, what is that, right? We don't know what that is. We don't know the muscles or how they work or how it all functions together. So a core breath, which is an essential part of pelvic floor health, diaphragm moves down, pelvic floor relaxes down, diaphragm moves up, pelvic floor contracts up, down and up, down and up. These expand, so support, expand, contract, expand, contract. So it's not just belly breathing, it's not just chest breathing, but it's all those things all at the same time. So as your belly grows, as your baby grows, do you think that this is impacted? Yeah, it's impacted. Like those of us that have been very pregnant know that at the end it's like, am I breathing? Because you feel like you can't like get a breath in. So do you think after the baby is born, your body goes immediately right back to this? No. It's been stretched out, it's been functioning, those muscles have been firing differently for an extended period of time. So in some cases we have a little bit of muscle amnesia, and that's part of that caring for your diaphragm, your pelvic floor, getting all those things just back online and functioning the way that they're supposed to. So in, out, up, down. Relaxation of the pelvic floor is the most important function of the pelvic floor. So I want you to make a fist. And I want you to squeeze your fist. Squeeze it as hard as you can. Keep squeezing it, keep squeezing it, keep squeezing it, keep squeezing it. You get tired yet? How does this feel? Does it feel awesome? No, really doesn't feel good yet, does it? Okay, let it go. Anybody have a pen? You want to try to like write your name with your hands in a pen? How would that go right now? Would your handwriting look good, normal? No. So if your hand just relaxes, it's a normal function. Write your name, not a problem. This is your pelvic floor. It could be like this all the time, or it's relaxing and contracting, relaxing and contracting. So remember what I said, a tight muscle is a weak muscle? I'm squeezing my hand, squeezing my hand. Is my hand strength good, or is it weak? It's weak. It's gripping. Okay, so just remember that analogy too. So relaxation, most important function of the pelvic floor. Okay, so everybody has one. Here it is, the pelvic floor. So ladies, here is ours, and gentlemen, we don't have any gentlemen there, just walk away, but there it is. So to contract the pelvic floor, to access the pelvic floor for ladies and for guys is pretty similar. So we have a sling-like complex. It's not simple, it's very complex, of muscles and fascia that support your internal organs. So what's kind of the bummer about fascia? A little bit of a bummer. If I blow up a balloon and then I let all the air out of the balloon, what is that balloon like? Is it exactly the same as it was before? It's a little stretched out, it may be a little shaken. So the fascia of our pelvic floor during pregnancy can become stretched. Does it go all the way back? No. Can it go pretty close? Sure. So then what does the job of supporting all of these wonderful organs we have here? What's left to do the work? The muscles. We have to have the muscles of the pelvic floor functioning and functioning optimally in order to hold in pee, in order to hold in poo, and then just to keep our uterus where it's supposed to be as well. So guys don't have as much to worry about. There is only the bladder and the bowel. But men with pelvic floor dysfunction can suffer the same kind of prolapses that women do. So all prolapses is just an internal organ that's supposed to be like up here starts to descend down past the pelvic floor. Okay, it happens. It does happen, but that's part of what we're going to talk about is like, how can we make that? All right, so there it is, very complex sling of muscles. So here it is, if we were to look down from like your baby's point of view. Here it is, trying to get out. And if you're a gynecologist, here it is, looking back in. So lots and lots of muscles, lots and lots of fascia, all kinds of muscles that need to relax and get out of the way if we are going to bury the baby, or lots of muscles that need to be able to contract in the right order with the right strength, because if any muscles are tight or overstrong, they are going to pull and they are going to misalign our pelvis. Not good if we're also trying to grow a baby. So lots of support. It supports the bottom of our pelvis, supports all of our internal organs. So imagine all the weight of just your internal organs now as you are. Add a baby to that. Add a full-term baby with placenta, with fluid, with the bigness of your uterus, all of that pushing down. So, a lot of work to do. Okay, so when we breathe easily, and this is like chronic for all ladies. So one of the things we're going to talk about is diastasis. It's kind of like a hot button word right now, right? Diastasis, right? Do I have it? Well, when we hold our breath for a long period of time, because we're trying to look skinny in our photos or what have you, like I need to have a perfectly flat belly because I had a baby and I need to bounce back in 6 weeks and all of that. Holding our breath creates intra-abdominal pressure, pressure down, pressure up. That is not advantageous to those muscles functioning optimally. So don't suck it in. Let it go. Just let it go. Let it go. Holding our breath, pressure comes in, pressure comes down. Diaphragm doesn't move the way that it's supposed to move. If we let it go, breathe easily the way that we all just want to. Imagine you're sitting in the car and driving, nobody cares what your stomach looks like. That's how we should be breathing all the time. Pressure comes up, pressure comes down. We get that release of your pelvic floor muscles. Okay, so relaxation of the pelvic floor, why is it so important? So we just talked about intra-abdominal pressure, and I mentioned the word prolapse before. So there are different kinds of prolapse. The most common is a bladder prolapse, especially if your uterus sits forward. Your bladder can start to descend down past your pelvic floor muscles into your vagina. Your rectum can do the same, or your uterus itself can begin to collapse down. This is not what we want. Can happen. So unhealed diastasis, those muscles being far apart. We're going to talk about why that happens or how that happens. We don't have optimal support. And hernias, umbilical hernias, that happens too. The diastasis, umbilical hernia stuff can happen even before you're pregnant as well. So these are just like, this is what happens if our pelvic floor doesn't relax, if we don't have optimal stuff going on. And the rest of what we're going to talk about is not doom and gloom. It is, how do we stop? How do we make better? How do we not fix but prevent? Okay. So, relaxation of pelvic floor. Women are often told to do Kegels to address any of the like post-baby stuff that is commonly talked about and thought of as normal. What are those things? And you can cheat and look at the screen. What are those things?
Peeing.
Oh yeah, pee. I sneeze, pee. I laugh, pee. I pee, whatever. Right? Ha ha ha. But is it normal? No, it's not supposed to happen after a baby is born. It doesn't have to happen after a baby is born. Leaking during exercise, another really common thing. CrossFit right now is making me a little upset with how they are normalizing leaking during exercise, which is not normal, should not be made normalized. Running, jumping, lifting weights. Inability to hold in gas or food. Okay, a little less common, certainly less talked about, but something that we also can experience. So without adequate relaxation, and we already did this with our hands, the squeezing of our hands, there is no muscle contraction. How can we weaken, or how can we strengthen a weak muscle if we can't get the muscle to adequately contract? So has anybody attempted Kegels before? Yeah, pretty much all of us have been told at one point or another, oh, you need to do Kegels. So how were you told to do a Kegel? It's like holding in pee. But sometimes we hold in pee like this. Is that good? No. That's not good either, because then we have our adductors firing into our pelvic floor, and that's not, like, we're not isolating those muscles. So squeezing like this, we're not using the right muscles. What else? Anybody else? Anybody ever told pick up a bean or a marble with your vagina? One way to think about it.
Not
Picking up a
actually.
tissue. Yeah. I was told, imagine you are rolling marbles from the backs to the front. Here's another question. Yeah, let's pick it up and roll it. If you were to do a Kegel right now, should anyone know what you're doing? Absolutely not. So if any of these muscles are firing, or any of these muscles are firing, we're not using the right muscles. We're not using that sling of muscles in that slide that I showed you to actually contract. And if all we're doing is contract, 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 will we always make these things better? No, because if we're already too tight in that muscle's weak and all we're doing is trying to squeeze it more, we're not going to get our desired effect. Okay? Does that make sense so far? Okay, so major reason for most of you sitting here to relax your pelvic floor is for baby to come out and to have the best, most optimal recovery possible. Everything gets out of the way, baby comes out, everything nicely comes back together. Okay, so how does this core canister change as we're pregnant? First trimester, baby's really small, not a whole lot's going on. Diaphragm is still up nice and high, and pelvic floor is not being pushed too low with just the weight of everything in there. As baby gets bigger, diaphragm, so the rib cage starts to come out this way, and more importantly, starts to come out this way. So diaphragm loses its ability to move up and down because it is stretched in this direction. Okay, that's why like our bras get tight, because our ribs are actually moving out this way. And then by third trimester, diaphragm, you can see that curve isn't as high. Baby's taking up a lot of space, pushing a lot of things up, and pelvic floor has started to descend just with the weight of everything. Let go, let go. Okay, so the abdominal wall. This is what everybody typically thinks of. Diastasis, six-pack. There it is. There's my core. These external obliques are muscles that are also visible on a lean individual. Yeah, okay. Rectus does this. Obliques do this. But then we have deep abdominal muscles that are designed more to hold everything in where it should be, to support and function as that core canister, the modification of our intra-abdominal pressure. Okay. Yes, Brittany.
Just a question, and you might have said this.
Yes.
Diastasis is what?
Bingo, right there.
Oh.
Okay. So at any point, if anybody has a question, and there are never any dumb questions or like, oh, I don't, ask it.
Okay.
Like that's why we're here. So if you have questions, please just ask them whenever. So this is totally normal. Linea alba separates its fascia, its connective tissue that relaxin as your pregnancy progresses. Relaxin acts more and more as something that prepares your pelvis, but it also prepares your abdomen to let space for baby grow. It's good. It's all good. How do I know that this is happening? What visual evidence do I have that this is happening in my body? A lovely thing called coning. So if you have been pregnant and lied on your back, which is okay as long as you're not nauseous, your legs aren't tingling, or you don't feel faint or anything like that, you can lie on your back. But if you try to sit up and you're contracting these muscles here, you will get that coning. And even after baby is born, you can still have some coning. That is this tissue that's soft. Okay, so what do we do to help bring together to support? That's where these muscles come into play. So we already talked about this contracting here to get these muscles to contract. Wait, did I miss a slide? Maybe I missed a slide. I'll get back to it. So during pregnancy, when we're choosing movement, because that's part of the reason why we're here too, is to figure out if I'm pregnant and I still want to move, I still want to be active, how do I go about making the best choices so that diastasis, which spontaneously heals in a lot of women that have good core canister control, the muscles are all firing, that will spontaneously heal. For some of us, like myself, it takes work to get those muscles to, oh yeah, whoops, we're supposed to be doing this. Okay, so during pregnancy, how do I choose movement that is appropriate for what is going on with my body? And you always, wherever you are, ask questions, find out what people know, find out, are they aware of the changes of a pregnant body, and do I feel comfortable with them leading me through exercise in my pregnancy? Okay, because it's your body. At the end of the day, it's your body. It's what's happening with you, and it's what you feel comfortable with. So does this movement choice prepare my body for birth? So is it respectful of and adaptable to the needs of the pregnant body? Looking at soft tissue, looking at how fast or intense are my movements. Are those intensity levels going to change? Is my programming going to be adaptable for the days where I just don't feel good, but I know that I need to move, or I just don't feel good and I don't want to move? Focus on functional movement. What's a functional movement? Anybody know? This becomes really important later. The further along in your pregnancy you get, the more you want to practice functional movement. But
A squat?
yes, a squat. Why is a squat really good to practice when you're pregnant? It's a position in which you can give birth, yeah. So it's great to be able to practice in your first trimester, second trimester, third trimester, something like squatting, because it could be a position in which you give birth. What else is a functional movement?
Picking stuff up.
Yeah, my baby's on the floor. How do I get my baby from the floor to wherever it is I need to put my baby? Or my baby is in the car seat thing and I need to pick that up. So deadlifting, squats, pushing, pulling, pushing up overhead. Those are all functional movements. So you want to focus on those during pregnancy because that's what we're going to be using most during the postpartum period. Targeted strength and mobility. Why is mobility important? We give birth like this. No, you want to relax, be mobile, have everything move so that when it comes time, you've already practiced how to be soft, how to be mobile. There we go. All right. So does this movement choice help establish good postpartum habits? That's the second question you always want to ask. Is moving forward, because pregnancy is temporary, but postpartum is forever, is this going to help me in the long term? So, ribs over hip posture. How do we get our core canister to function optimally? We want to make sure that our ribs are over our hips, so good postural alignment. Is it pelvic floor considerate and or pelvic floor safe? So, is a lot of running, jumping, and lifting heavy considerate or safe for your pelvic floor during pregnancy? Now, we really shouldn't be doing a whole lot of that. There are many, many, many things that we can do that would be as challenging, but much more considerate of your pelvic floor. Emphasize function over aesthetic. Oh, Lord. Aesthetic. So, who is it? Khloe Kardashian, who just gave birth, and her sister, right? Khloe Kardashian was like, I'm working out during pregnancy. It was all about aesthetic, right? So, nobody cares how fit you are during your pregnancy. What people should be caring about is how do you function after the baby comes out, right? So can you hold and pee when it's necessary? Or do you look like $1,000,000? Frankly, like for my mental health, I'd rather not pee everywhere. just saying. So, function over aesthetic. If anybody is ever trying to pressure you, and that goes for social media too, because everybody's on social media. So if you are pregnant and find yourself looking at I should be doing this, or this is the way that a pregnant body should look, or whatever is a trigger for you that is a trigger in a negative, delete, 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 delete. Okay? So for my CrossFit ladies, any CrossFit ladies that you're coming across that have had babies before, and they're like, look at me squat 200 pounds. Get rid of it. Okay? Get rid of it. Okay, so what's happening in the body? Trimester 1. Oh, trimester 1. So rapidly changing hormones affect both physical and mental well-being. There's a lot to worry about in trimester 1, and there's also a lot that you're not feeling awesome about either. Sleep and nutrition may be challenging. Just a smidge on the nutrition. Cardiovascular system ramps up to accommodate the demands of pregnancy. Immediately, your cardiovascular system changes. One of the first signs that you'll know that you're pregnant is your heart rate goes up like 5-10 beats a minute. You're like, why am I hot and my heart beating fast? Like, what is happening? Oh, because you're pregnant. And connective tissue begins to soften then. So your body starts to relaxing really early, which is even if you are not telling anybody you're pregnant, even if you don't feel pregnant. You don't look pregnant because nothing on the outside has changed very much. Even moving into like week 8, week 9, week 10, week 11, you need to tell whoever is leading you through whatever exercise program you're doing so that they can modify appropriately for you. Like immediately weight should start to come down. Immediately intensity should start to come down. So begin to practice diaphragmatic core and floor connection breathing. Oh my God, what is that? So here's what you're going to do. You're going to put your hands on your ribs like this. I like to put my thumbs behind because I tend not to breathe into my back ribs. But so here you are. What you're going to do is you're going to try to expand your ribs into all of your fingers. So front, sides, and back. And then you're going to let it out. This is great too because it resets the fight or flight. It sends you back into rest and repair. So core and floor connection, all we're going to do is we're going to add a little gentle squeeze. So that lifting up of the beam, lifting up of the marble, lifting up of the tissue. You just get a gentle contraction as you breathe out and diaphragm moves back up. Your pelvic floor should be coming up and contracting. So nothing happening here, nothing happening here, nothing squeezing here, but just a little gentle lift. So as you breathe in, you may feel kind of your perineal area pushing down into the chair, and then as you breathe out, you just may feel that pressure resolve. Okay? If you can get that pressure to come down, like if you can actually feel perineal area like on the chair, that's a good relaxation. Down you come, breathe out, up it goes. So there you are, core and floor connection breath, and this can be done in lots of different positions. So move in trimester 1 in ways and at times that you feel good. Oh yeah, please, go ahead. Fight or flight.
Yeah.
So when you're stressed out, when you have like
just
anxiety.
labor. I didn't know if you were talking labor specific.
Oh no, I'm talking like in general at all times.
Okay.
So it's a really good thing to practice before you go into labor, because if you're like, I'm really good at resetting myself and going back into that rest and repair, then you can take the edge off essentially of what is happening with your body and relax and work with it instead of in the heat of anxiety maybe fighting against it. Okay, so moving out ways and times that you feel good. This can reduce fatigue and nausea, just moving around. In my first pregnancy, I really struggled with times that I felt good, and I found that if I moved, I actually had a bigger window of the time that I felt good, as opposed to just feeling like death for like 14 weeks. Increase the frequency of rest, even this early. So again, you might not want to tell everybody that you're pregnant, but if you are you have a personal trainer, you go to CrossFit, you do whatever it is, and somebody's leading you through exercise, you need to tell them so that they know that you might need a little bit more rest than usual because you just don't really feel that good, and that's okay. So rest times or breaks become longer or more frequent. Rest days become more frequent because really you need to sleep. That first trimester, placenta hasn't come on board yet, your body's doing it all. Give it a break, give it a rest. Okay, so you're going to reduce intensity, weight, speed, impact. Change of direction too. So if you're doing a lot of change of direction, kind of mobility, agility kind of stuff, you want to reduce the intensity of that as well. Prioritize ribs over hips and functional movement, which we talked about. Squat, deadlift, row, press, lunge. Lunge becomes important later. Include additional thoracic and hip mobility, so whatever that looks like for you. Thoracic is here. We want to make sure that we're opening up here as weight increases and we start moving more and more forward. We want to make sure that we're able to open ourselves up. Hip mobility too, we want to just make sure that everything, as many of the muscles as we can get to be loose, relaxed, and allow everything to open up, we want to give that space. And begin to limit traditional ab exercises. Crunches, sit-ups, planks, toes to bar, anything that is contracting here, 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 here. When we contract here, we start to move everything apart. Okay, so trimester 2, yay, the golden trimester. This is usually when everybody feels their absolute best. So you get a return of energy, reduction of fatigue. You can finally sleep, you can finally eat, everything is great. Growing breasts and belly begin to impact the center of gravity. So everything starts to move out, and so does your center of gravity, so you're more likely to tip forward. We also start to get this happening as we try to reset everything, which as soon as this happens, what starts to compress? And then the low back pain starts. So connective tissue is still continuing to soften. It gets softer and softer as time goes, and the pelvis becomes a little less stable. Pelvic girdle and or low back pain may present. What is your pelvic girdle? Anybody have any idea? If your core canister is all this, what do you think your pelvic girdle is? All this. So it's not just in the front, although a lot of women that are pregnant complain of pain like right in the front of their pubic symphysis. It can be low SI joint pain on either side and or tailbone pain that can indicate that something pelvically is not happy. So if you start to get some SI joint pain, for me that was like the huge trigger. I never had anything in the front, it was always in the back. Just something to be aware of, that something's not happy, something's not stable. All right, so movement recommendations. Practice the diaphragmatic core and floor connection breathing, and now you want to try it in a bunch of different positions. So start to move around. What does it feel like? Can I access those muscles to contract them? And then more importantly, now that I know that I can contract them, can I get them to relax? So you will feel that descend. Continue to modify workout duration and frequency of rest. So now maybe instead of doing an hour-long workout, we're talking about 40 minutes. And just frequent breaks in between. You should never end a workout exhausted. Okay, from this point forward, no workout should be exhausting to you. Your body needs to spend the energy growing the baby and making sure that you and everything about you stays online. Okay? Continue to modify and reduce intensity, weight, speed, and impact. Again, based on how you feel. Again, this is the golden trimester, so some days you may feel great and some days you may be like, not today.
Question.
Yes, go ahead.
So how does this apply to real life when you have little kids, or, you know, like, I don't work out usually, but, you know, I have to like move, I have to do stuff. You know what I mean? Like,
so
I
give me
can't
an example.
Making lunch.
So how does
For
this
the
apply
kids,
to making
yeah.
lunch?
Just having to be on my feet and moving around, and that's not, I mean, even though it's not intense, it's still really hard at times.
How can you use it in everyday life when you're not at the gym? I think, is that the question?
Right.
Yeah.
So what we are talking about specifically is at the gym, but so like for second trimester, the things you would want to focus on are your functional movements. So instead of picking something up off of the floor like this, you'd want to start practicing hip hinge to pick things up off of the floor, which as belly gets bigger, feet will be wider and wider, but you're going to practice. So good from here to here, bending forward, losing bad habits as you're standing up. Not standing up here because this feels a little bit more comfortable. Look at how far my pelvis is in front of my shoulders. Really practicing standing here. When you're sitting on the couch, making sure your butt's all the way back, sitting up nice and tall, but then letting everything relax. Walking. So if you're second trimester, start walking and taking your kids for a walk. And as you're moving around and you have to, like if you have to chase after them, you have to chase after them. But as much as you can, not moving quickly from side to side, things that you have been picking up that are maybe really heavier that you're starting to strain with. So all of us pick things up that are probably too heavy and we start to strain. Being able to breathe, connect, so that core and floor connection breath, that's something that you'll want to practice. Exhaling on exertion is another thing you'll want to start to practice, because as we exhale, what happens? Pelvic floor contracts. So if we're going to pick something heavy up like a big laundry basket and picking it up from there, trying to keep shoulders and hips exactly square to where they are. Is that more applicable? Okay, does that?
I just wanted to clarify.
Yeah, no, that's fine. That's good. Okay, so yes, go ahead, Gina.
So when I was pregnant, and I know that you were talking about like intensity in there, but I felt like I always heard different things of like how you know you're not over exerting yourself or pushing yourself too far with the intensity, because I think when you're doing things like I did CrossFit with Ryan, and then this time I did spin, and I heard like, you know, you have to watch your heart rate, or you have to be able to hold a conversation while you're working out if you can't speak or talk. I just kind of felt like I was still like maybe pushing myself too much and not really knowing when
Pushing yourself too far.
Yeah, like how do you know that intensity is just too much? Or
if you are exhausted after a workout, if you're like really tired and usually tired, if it starts to impact how you or the baby are feeling. So like nagging aches and pains are another really good way to kind of figure out like, yeah, maybe I'm doing too much. Same thing with like real life. If nagging aches or pains are starting to pop up. Okay, well, what do I need to do differently, or how can I ask for help, which is so hard, but how can I ask for help in doing the things that are creating just me not feeling awesome all the time? I think if you err on the side of caution, it's more beneficial. Again, pregnancy is so temporary that if you walk away with nothing else, just give yourself a break for like a year. It's just a year. And you're going to have this little tiny baby for that 4th trimester. That's where that year comes into play, where that baby's going to be that tiny for that period of time. And then they get bigger, and then they start, doing all the things that babies do. But if we don't take care of ourselves during that year, when is it going to happen? Because everything just gets faster from there. Okay, so trimester 3, which it seems that most of us are either in or approaching. Yeah? Okay, so return to fatigue, reduced sleep, increased discomfort with everything, low back pain, pelvic girdle pain, again in the front or in the back, groin pain, so they call it vaginal lightning, which can happen. You laugh now until it happens.
Sounds like such a cool name.
Incredibly uncomfortable. Yeah, so either up, down, or out. That is another big sign that we're doing too much. Braxton Hicks contractions are supposed to happen, but if you notice that they're happening more frequently or with more intensity, that is another huge sign to slow down and drink some water. Most people do get some fluid retention due to hormone changes. There's really nothing that we can do about that. Movement, though, lots and lots of walking, keeping everything going is another really good way to just keep all that fluid moving so that it doesn't pool or sit. Connective tissue still continues to soften, and then we are going to have the pelvis getting ready for birth. So diaphragmatic breathing, down, out, in, out. Practice intentionally relaxing the pelvic floor in a variety of birthing positions. Start that as soon as you can, as soon as you want to, so that you know how to do that when the time comes. Continue to modify workout duration and frequency of rest. Again, never-ending workout, exhausted, and move in only ways that make you feel good. So spinning for your brain was really good. There is something to be said about that, but the aches, the pains, the fatigue, if you ask yourself, did I do too much? What's the likely answer? I probably did too much. Yeah. So that's also another really good cue for any of you guys if you're just like, So ribs over hips. Let's actually all stand up and practice that for a minute. Because we either default to one of two. We either default here, and this is like typical baby carrying posture or late pregnancy posture, or we default to rib flare, which neither one is good. So kind of turn so that you can see you're sideways to each other, and then check out the person across the room from you. Are my so shoulders, ribs, hips, and then you can even start to look down at knees and ankles. And am I in a nice line? If you feel like you're in a nice line, you can breathe in. Think all of it. So let your belly out, and then breathe out. Breathe in, breathe out, in that nice aligned posture. What does that feel like? So it should feel pretty good. You should feel movement. You should feel relaxation, ascending, descending. Yeah. Okay, so we're going to continue to modify reduced intensity. You guys can sit down now if you want to. Third trimester, really important to incorporate the walking. So walking is a really great way to help the baby get into optimal position, to help the pelvis, because the pelvis is soft and relatively unstable. I mean, relatively, we're talking about muscles, so holding everything in place. Soft tissue is nice and soft. But to help that, help your pelvis, in its ideal alignment. So a lot of really good stuff happens with walking, plus it helps keep your cardiovascular system toned, right? Because birth is not just a whatever event, it is hard work. Labor is hard work, so we do need to have some in shapeness on board, but we do not need to train for birth. And I know that there is an entity out there that says that we need to train for birth. Maybe. I'm just going to leave it at maybe. Walk, 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 walk. If in very late pregnancy walking for a long period of time is uncomfortable, just break it up. Break it up into 10 minutes, 15 minutes. Just move, sway, like Brittany was doing, swaying, all of this pelvic movement stuff. It's going to help baby and gravity do a little bit of work. Prioritize movements like birth fit, functional progressions. If you have not yet made yourself aware of birth fit functional progressions, they're all on YouTube. They are a series of, I believe there are 6 of them now, progressions that you can do all the way through pregnancy, all the way through postpartum, that help the muscles that we need to keep our core canister functioning well and healthy, keep those online, but are pelvic floor safe and considerate, are considerate of the needs of a changing pregnant body, all of that lovely stuff. I want to focus on functional movements that mimic post-birth activities, like the picking up of all of the things, the moving of all of the things. So weighted carries. We're going to hold a baby. So let's imagine an 8-pound baby and a 10-pound car carrier. Here we go, with our super soft abdomen that has just given birth. So how do we train for that? We pick something up and we walk around with it while we're still pregnant. We walk with it on the other side. So don't be the person that always carries the car carrier on the one side. Be the person that shifts from side to side. Shift the baby. Get used to having the baby on this hip, then on this hip, then this hip, then on this hip. Because if we only strengthen one side, what happens to the other side? It doesn't function as well. So banded resistant movements, keeping all of these, so our glutes nice and strong, is going to help support our pelvis late pregnancy and then through the postpartum period when we need some support for our pelvis. Thoracic and hip mobility still stays consistent. Chest stretches, because soon milk will be coming in and now the weight is going to be even more. We want to make sure that we're nice and open. And then cat-cow or child's pose is going to be really good for late pregnancy, and again, just giving your pelvic floor a release from all of that weight, and again, optimizing how baby can move and change in there for position for birth. Okay, so baby has come out. What happens?
That was easy.
Hormonal fluctuations. Yeah, boom, blink of an eye, out it comes. So, rapid hormonal fluctuations a la trimester 1. Everything just comes crashing back down. Good, normal, doesn't always feel awesome, but it's supposed to happen. Spontaneous healing of diastasis. If we have been good to our core canister and everything is functioning online, pelvic floor and associated tissues are also spontaneously healing, no matter what kind of birth you've had. So even if you deliver your baby via a C-section, all that weight has been down in your pelvic floor the whole time you've been pregnant. So that tissue still needs a little bit of care, a little bit of love, and still needs to heal. Okay, so what are we doing in the 6 weeks after the baby is born? So this is, yeah, right, run a marathon. This is before you are cleared by the doctor to resume your normal activities. So how can you kind of, because a lot of us are like antsy, like, oh, what can I do to start getting my body back? But we talked about that. Does your body actually ever come back to pre? No, because it's had a baby. So celebrate that. Celebrate the fact that you made lovely human being. So we're going to reintroduce the diaphragmatic core and floor connection breathing. You can start that the day you give birth. Baby comes out, what am I going to do with myself? I'm going to breathe and just see if I can get those muscles going. Why would it be important to contract those muscles even right after the baby is born? What's happening? Our brain is talking to those muscles and saying, hey, wake up. And we're getting blood flow. If a muscle is going to heal, if anything in our body is going to heal, it has to have blood flow to bring all the nutrients and important things that muscles need to heal. Focus on ribs over hip posture and thoracic mobility in those 6 weeks. Gentle, gentle, gentle with our bodies. Walk. Starts out with maybe a 5-minute walk, and then a 10-minute walk, and then a 15-minute walk, and then maybe 2 15-minute walks. Carry the baby, don't carry the baby, put the baby in the stroller, whatever is comfortable for you, but just get outside and walk if you can. Walking gently tones your pelvic floor. Just like breathing gently tones your pelvic floor. Increase speed and duration as energy levels and schedules permit. I feel like $1 million. My baby is screaming all day today. Okay, well then I go out for a 5-minute walk. Or maybe baby is screaming and they love the walk, and so I'm just going to hang out outside for like 2 hours and walk 15 minutes and then rest 10. Walk 5, rest 15. And just kind of go through it like that. Practice, 7 to 12, sorry, I missed the top part. So we're still practicing diaphragmatic core and floor breathing, ribs over hip posture and thoracic mobility, again, because weight is forward. Whether or not you're breastfeeding, your breast tissue still changes, weight is still forward, so we want to really open that back up. Walk, 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 but don't run yet. Okay, why don't you think is still kind of at risk of, what is still fragile. Yeah, your pelvic floor is still, it's still kind of like figuring out what to do, and we just don't want to overtax it yet. So let's say you are walking like you're supposed to. How might you know that maybe something isn't quite right? Yeah, you might have some pain. That's usually a good symptom that nobody really thinks about, like peeing is an obvious one. But if you have any pain or something doesn't feel right, that's usually a good sign that something isn't quite right, and just rest or start asking questions. Not like on Google or WebMD, but just start asking questions of people that actually know something so you don't totally freak yourself out. Still, so your doctor says, oh yeah, sure, you're cleared to go do whatever it is you want to do. It's not really the answer that they're trying to give you. Still no planks, crunches, or traditional ab stuff. The soft tissue is still soft. These muscles may not have remembered yet exactly how it is they're supposed to function, and so we have to help them along. So spontaneous healing does happen, but diastasis can persist. So contraction of the rectus abdominis, these right here, pull at the linea alba. So as these muscles pull and bring us forward, they actually pull on that tissue and separate it. When those muscles, rectus abdominis, contract without the support of everything else, pulling, and that's persistent diastasis. Okay? So a test that you can do to see, we're not going to do the diastasis test here, but one of the things that you can do at home to see, am I rectus abdominis dominant, which is one thing that can contribute to persistent diastasis, is if you do a little crunch and you get this big mound of muscle in the middle, but like nothing happening on the sides. You can like poke in there and it's soft on the sides. That's rectus abdominis dominant, and that is one of the things that can lead to persistent diastasis that does need, and that's where comes in like, okay, let's get these muscles to function. How can I get my entire core to work optimally? All right, and pelvic floor dysfunction. So I already asked, how do you know if something's not right? Pain is one, very good. Not holding in pee or poo. And then any symptoms of prolapse, which we very briefly talked about, but what those symptoms look like are a feeling of pressure or heaviness or even tightness in the perineal area. So if you're walking around and you just feel kind of heavy, which is normal very soon after birth, again, because those muscles are still, they're trying to work, they're trying to figure it out. But if that persists or gets worse, you just need to ask some questions, just start talking. All right, so the postpartum period, which we already talked about as being forever. So in 6 weeks, some people define it as postpartum, 6 weeks. Doctor says, go, go. Is it true? Not really. 12 weeks. So maternity leave is over, 4th trimester is over, postpartum period, finished. But does that mean we should stop doing our postpartum work? No, because it really isn't over yet. A year, that's about how it took almost a year to grow a baby. Guess what? It's going to take a year for your body to like come all the way back together. So mentally, when you're thinking about, oh my God, what am I doing? Give yourself a year. Give yourself a solid year. So Oliver's not a year, right?
Nope.
Yeah. So still in really a healing postpartum period. Lifetime, we can always work to improve the way that our body is functioning, to improve the way that we feel. If subsequent pregnancies are coming, that in-between time is a great time to really care for your body. And the better habits you have during pregnancy, the easier it is to maintain those habits through early postpartum, which means we get better healing immediately after, and those habits can carry on to prep our body for a possible baby 2 or 3 or 4 or 5 or however many it is you want to have. Maybe it's just the one. So, enter the postpartum period knowing you get the pleasure of discovering a whole new you and a whole new normal. The demands on your time and the demands on your body are like nothing you've ever experienced even being pregnant. Everybody in this room that's had a baby can attest to that. It's very different. Speak up when something doesn't feel right or function the way that it's meant to. Speak up to someone you trust, speak up to a doctor, speak up to anyone. And don't let anyone dismiss your concerns. Okay, because if something is happening in your body that wasn't the way that it was before, don't, oh, well, you've had a baby. No. We want to know what's going on. So be persistent, talk, go up the line, go up the chain, right? With somebody that is dismissive of you, no, we need to talk to somebody else. And seek out somebody that knows what's going on with you. Okay, because somebody out there will know exactly what you're talking about and they'll know exactly how to help you, whatever that help is. So, resources. Where can you go to get good information about what to do in pregnancy, postpartum early, postpartum mid, postpartum in the forever stages? Jessie Mundell is awesome. She's out of Canada. Fabulous resource, tons of information. She has a 2 pregnancy and beyond program that for at home, you're like, I know I need to move and I'm not sure what to do. Her programming is fantastic. Moms Gone Strong is another program that if you have a personal trainer and your personal trainer has access to a Moms Gone Strong or is willing to access that for you, that is another set of programming that is very specific for pregnancy, different stages of pregnancy and postpartum. It's all the way that it should be with protecting your pelvic floor, protecting your body, and allowing it to function optimally. Brianna Battles is another excellent resource. She's out of the West Coast. She is a high-level athlete coach, but her focus right now is with high-level athletes through pregnancy, through postpartum. What does that look like? What does that feel like? How does that apply to every human being? And then BirthFit is another really excellent resource. The functional progressions that I talked about, those functional progressions are online. Their programming used to be online, it isn't online anymore. My one kind of little caveat with that is if you are one of those people that is triggered by like, look at what that fit pregnant lady is doing, or I'm going to define my fit pregnancy by what somebody else is doing. Some of the stuff that they post on social media can be a trigger for some people. So just kind of know that that is out there, and if that's something that you know will push you to a point where you probably shouldn't go, that's part of that. So my email, my phone number for text, and then my website is all there. So I do prenatal and postnatal training. Right now it is all private, and all the information for any of that private training is available on the website. So you guys have access to all of that. But hopefully this was good and I didn't scare everybody.
Do the other resources have websites or anything posted on YouTube? Or?
They are everywhere.
Okay.
So BirthFit is all over Facebook. They're all over Instagram.
I'm familiar with them, but the other
Brianna
ones.
Battles, same. All over Facebook, all over Instagram. Both are probably more active on Instagram than they are on Facebook. Moms Gone Strong, same thing. Once you start to look, you'll see them everywhere. Jessie Mundell, because she is out of Canada, she is, again, Instagram and Facebook. Her programming, the 2 pregnancy and beyond, is really excellent for, like, if you're not going out and you don't have a personal trainer, you're not a part of a gym, it is really good programming just to know how to move and what kinds of things that you can do. And she works out, so she's pregnant for the 2nd time. Her daughter is 2.5, and she posts videos all the time of, like, working out in her basement with her kid. It's hysterical. It's really awesome, and it's also inspiring to you to see that, like, okay, so I was supposed to do 12 of these and I only did 8, you know what, that's okay. Permission to say, that's okay, it's good enough. Because in pregnancy and postpartum, we should have the ability to do that. That's okay, that's enough. Right? It's really hard to do that as women. It's really, really hard because we have this expectation that we're supposed to be X, Y, or Z, which is where the aesthetic comments were coming in before. It is enough. We are enough. So there it is. Any questions? Any final questions? Any final comments?
That's great. Thank you.
Yes, you're welcome. My pleasure. All right. So, there we go. We can lie down on the floor and do our floor and core connection. I know I told a couple people we're going to be lying down on the floor, and we didn't actually get to lie down on the floor, so we can do that now if you want. Good pelvic floor relaxation if you want to lay down on the floor, put your knees up on a chair or on a couch or on the wall, not like squat position. That's another really good way to access relaxation of your pelvic floor. It's nice to sit down so you can actually feel a little bit of like feedback, pushing down or coming back up. But that's another really good position to get into to help relax your pelvic floor. So, and don't, I can't believe I'm going to say this, but don't be afraid to self-explore too. And find out where muscle tension or tightness is, because those muscles, just like any other muscles, could have trigger points, tightness, areas that are painful, and you know yourself best towards them too. Okay, I'm really done now.
Thank you.
Yeah, you're very welcome. You're very welcome.
How did you